Hi guys. Hi. Hi guys. You are welcome. Welcome. You are welcome. Welcome. You are welcome. 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 This is your favorite doctor, Dr. Tonia of True Health with Dr. Tonia. Yes, that's me. You all are highly welcome to my life. Today you are streaming live in different platform, which make it so beautiful. You know, the interaction I have with my audience, my fans, beautiful people all over the world makes it very interesting for me to come here every time and give you all you need to know about medical, you know, being a qualified medical doctor and having seen it all. It is my duty, which I bestowed on myself, to come out here live and give you the nitty gritties of some medical issues. Listen, you all are out there getting some medical issues that you have, and you don't know what to do. You end up going to babalawos, to churches, to people that don't even know anything. They use you as guinea pigs. When stories, it saddens me so much. So that's why I decided to use my social media handles to give you trainings, to give you teachings on what to do when you come across any health issue that you face. So, be it as it may, you guys, you all are highly, highly welcome. Before we go on, I need you all to just do me one thing. Listen, take your gadget. If you're on Facebook or YouTube or anything, clear the share button because guess what? You have to invite people to come in so that we will learn together. Because guess what? If you learn and another person doesn't learn, and this medical issue that I discussed today, that person face it, and you know that, oh, you see, if I had invited this person, this and this wouldn't have happened. You're going to be blaming yourself. And that is one thing I don't want you to do. So please click that follow button and please comment and be interactive because guess what? My favorite part of my talk show is when I give you out money. Okay, of course, a lot of people are joining me in different social media handles, but you need to share the live so that a lot of people come in and very important. When I say very important, this is a live, and any little mistake you make at that time will cost you so much. That's why our case study today is hairstyle and hair tutorial and hairstyle. She is a Nigerian um, Facebook, Instagram, and every other network, even in YouTube. She has her platform where she teach how to do hair. Now she has started showing her lifestyle. She took us with her when she got pregnant. How did she get pregnant? She has been having problem getting pregnant naturally. So her two babies, she had them by doing in vivo, in vitro fertilization, IVF, right? So in this third pregnancy that she wanted to get pregnant, she carried everybody along, and people were really interested to see how the process of this IVF worked for her. But alas, just when everybody thought everything is really, really working out for her, the evil master who doesn't want any good thing to come to anybody came on. And unfortunately, she developed the topic we are doing today, which is ectopic pregnancy. So before we go on, This is your Facebook page. When you go on live, click on the share button. Okay, that arrow that goes left, it is on Instagram, it is on Facebook, it is on YouTube. You all need to click on that share button so that a lot of people will come in. Guess what? If you bring in only one person to this live, you may be saving a soul. So if you have a heart of gold, just like every other person, which I know you have, share this live so that people can come in and contribute and even listen. And guess what? The favorite part of my show, win the gifts. So let us get in and do the needful. So, how are you all doing? So, why I'm doing this, I want all of you to share this live. Some people are trying to call me, so I am trying to tell them I am on my life and I can't answer any of their call, because guess what? You are so important to me, because this topic is so very important. That's why I am streaming live in all platforms, so that you all will get to get all the nitty-gritties about ectopic pregnancy. Have you all heard about ectopic pregnancy before? If you have heard about ectopic pregnancy, comment on the comment section. Let me hear how many people that have heard about this very important topic. Have you heard about ectopic pregnancy? What is it about? Can you all just give me a little bit of what you know about ectopic pregnancy? What do you think ectopic pregnancy is? Guys, what do you know ectopic pregnancy is? Okay, before we go on today, the main topic of discussion, I want to ask you again, have you shared this live? Because this is a very, very intense discussion, which I know you are going to learn a lot. Okay? All right. So now listen, let me show you something. I want to show you something that will be beneficial to every one of us, before, so that when I'm discussing the ectopic pregnancy, you will understand exactly what ectopic pregnancy means and why we all should be very, very careful. All right, so you guys, are you seeing it? What do you think this is? Comment on the comment section if you know what this is. Comment. This is a pictorial demonstration of something in a woman's body. If you know this and you type what this is, this picture is, you are going to get one of the giveaways I'm going to give during this live. All right, I'm giving you 2 seconds. Look at it very well. What do you think? What is this? What do you think this is, guys, in Facebook, the people in YouTube? What do you think this is? What organ it is? Okay, if you don't know, I will tell you. This is the female reproductive organ. Okay, so I'm going to start from here. This is the eggs. All right, this is the egg. This is the fimbriae. All right. Because what is important is you need to know what the female reproductive organ is, so that when I'm discussing this, it will be very, very simple for you to understand it. Because if you don't understand what female reproductive organ is, when I'm discussing whatever, you won't be able to know. So let's go back again. I'm going to bring another pictorial demonstration, okay? All right, so that it will be very, very clear for you all to understand what I mean. Now, this is the eggs of every woman. This is the fallopian tube. You know, this tube here is the fallopian tube. It is two, always, always two in every woman, right? This is the uterus where the baby stays. And even when you look at it, you will see that it's written there, okay? This is the cervical canal, this little thing here. And this is the cervix, and this is the vagina. All right, you guys, you saw it, right? Good. But for whatever reason, either you have previous surgery, or you had an infection that wasn't treated, or you have had previous IVF, or you have had IVF, or you are about to have IVF. The egg that is here, okay, the egg usually is in this particular place. This is the egg, right? When you copulate, what it means is when you have sexual intercourse here, right? This is like your vagina, the female vagina. You know, when you look at a woman, you see the clitoris, you see the labia majora and labia minora. That hole that the penis enters into. I'm a doctor, so I'm sorry I'm using all those words, but I mean, if I don't explain it like this, you won't be able to understand it very well. That hole that the penis penetrates inside, right? This is where it is. And that is called your vagina. When you copulate and have sexual intercourse, the man ejaculates. That the man releases. That's what you call it. But we call it ejaculation, right? So when he ejaculates here, the sperm, the semen that contains the sperm, semen is the fluid that the man ejaculates, starts and find its way all into the uterus. Now, there are millions of sperms going on, right? These millions of sperm, all of them are kind of, you know how it is. When you open a pap, you see the way the pap water pumps and come out. That's how the ejaculation happens. When the semen is ejaculated, the millions of sperm in that semen start running. Everyone is just running, swimming, because they are, you know, they in that semen, and they find their way. Some find their way into this fallopian tube. Some other ones go to this place and find their way to this fallopian tube. But now, if a woman is on her ovulation period, you have seen your menses, 14 days after your menses, your ovulation is happening, this egg is released. So the egg is coming this way, finally lies this ovum, right? And when this sperm comes, the first sperm that comes in fertilizes this egg. Okay, at this time we call it ovum. When it fertilizes the egg now travels down and gets implanted on the walls. Can get implanted here, can get implanted there. It depends, but usually it's supposed to implant here. That is the normal way the female and male reproductive organ come together to form a zygote, that is, form a baby. Now, when the implantation happens, the baby start growing. Okay? But now for ectopic pregnancy, the egg leaves fallopian tube. The sperm is ejaculated. The semen is the wall of the fallopian tube. This egg implants on the fallopian tube. Now, there are sometimes the egg will not be able to come out here. The sperm finds its way and fertilize the egg here. You have abdominal pregnancy. So that's why there are some people that pregnancy will develop in the abdomen. You heard me right. I'm not talking about the uterus, the abdomen. All of them are ectopic pregnancy. Now, there are some people too that because of adhesion, let's take for instance, you've had a sort of termination of pregnancy that was not done properly. So you have what we call Asherman syndrome, and your womb, okay, is closed up. When the egg comes, it finds its way. You know, these are eggs. They are very, very minute and very small. So it will still find its way, even though that there's Asherman syndrome. It will find its way, and then sometimes so what it means is any implantation that is not in this uterus, are you guys seeing it? I'm sorry if I'm not showing it. That has happened outside the uterus is what we term as ectopic pregnancy. Okay? So you got that, right? So let's go in and discuss, because I wanted to show you that so that you understand what actually we are discussing today. All right? Now, this ectopic pregnancy occurs often, okay, in majority of people that have a form of fallopian tube tightening. Okay, let's say you've had previous surgeries, you've had previous ectopic pregnancy. The doctor opens it up, remove the zygotes at that time, and then stitches it in. Now you have a scar. Remember, when you have a scar on your body, when it heals with fibrosis and there are scar tissues there. It is still the same thing. When you have a scar, they have removed the zygote that was there and close it up. Of course, you're going to also have some form of adhesions and some forms of scar that could make the egg not to move down. Okay? Now, sometimes ectopic pregnancy can occur in other areas of the body, which I have already told you. Okay? It can occur at the ovary where the ova is. I showed you that part, right? Good. It can also occur in abdominal cavity, that is in your abdomen where your intestines are. Yes, you can have it there. And the lower part of the uterus, which I showed you, the cervix, okay? Right. Now, this cervix connects to your vagina, the vagina where the sperm thrust up and down and then the ejaculation happens, okay? Now, if you have a healthy pregnancy, of course, the fertilized egg will attach on the uterus and you will have your pregnancy till birth, till death, till your gestational age, which is 9 months. We call it 40 weeks, but you people call it 9 months, right? 40 weeks of carrying that baby, you will deliver your baby. But guess what? There are some people that can deliver their baby 2 weeks before 40 weeks, 2 weeks after 40 weeks. They are all normal pregnancy. All right? Now, if for any reason the egg, when it is fertilized, implants in anywhere or somewhere that is not inside of the uterus, I've said it before, okay? But one thing I should make you all understand is the fallopian tube takes about the greatest percentage of this ectopic pregnancy. Yes, you can have it in other places, but majority of the ectopic pregnancy happen in the fallopian tube, because as you can see, it's the fallopian tube that the egg comes down at all times to implant. So yes, some can be abdominal, some can be at the cervix, but then the major thing is at the fallopian tube. Now, what are the symptoms and signs that you're going to feel in your body? Okay, this woman is not pregnant, you're seeing your bleeding, everything is going on well. Suddenly, you stop menstruating. There are some people that still menstruate, because there are some people that get pregnant and they still have their menses going on, right? Until at the time when it's going to stop. So it is the same thing that happens in ectopic pregnancy. All right. Now, some people that have ectopic pregnancy may have just minute signs. So sometimes you have this ectopic pregnancy, you don't even know that you have ectopic pregnancy. Okay? And then there are some early signs that you can, if you know your body very well, there are some early signs that you're going to see that will make you understand that, oh, you are pregnant. All right? Now, if you have a missed period, of course, any woman that have a missed period will always say, oh, am I pregnant? Yeah, there are some times that you might have a missed period because of infection or so many other things. But when you have a missed period, that's an early sign to say, oh, am I pregnant or not? Right? You start having breast tenderness. You touch your breast, or your husband touch your breast, or when you're passing and immediately you move your breast on somewhere, you have this pain. All right? Then you do a pregnancy test and it comes out positive. That is early signs to show you that you are already pregnant. All right? Now, if you have ectopic pregnancy, the likelihood that that pregnancy is not going to continue, or it's going to cause a lot of problems to you, is 100%. So it is very, very important you know your body. When you start feeling all these signs of, nausea, early morning vomiting and all those things, always know your time, because most people that have ectopic pregnancy get problems when they have started breastfeeding their baby, because you are not seeing your menses. You just had a new baby. You're not seeing your menses. So when you are pregnant, you might not know. So that is very, very important. That's why I'm mentioning hairstyle. We went to the hospital and they said, oh, there's nothing in the womb, but we're going to be the pregnancy test shows positive, but didn't see any sign of the baby in the womb. All right. So when this egg implants in a place that is not in the womb, you will start having exaggerated signs and symptoms. If you were vomiting before, you're going to be vomiting more. If you're having fever, you're going to be having more fever. You know what I mean? And the breast engorgement is going to be more. And these are the things that you need to pick. If you pick them on time, it will help you to diagnose yourself on time and get to the hospital on time. Because guess what? In managing ectopic pregnancy, it is a highly, highly emergency situation that if you don't do what you need to do at the right time, the possibility that you may enter into dangerous situation is there. Okay? Now, if you start feeling light vaginal bleeding and pelvic pain, you are pregnant, you're seeing light vaginal bleeding, the thing has shown that you're pregnant, right? You now start seeing light vaginal bleeding. It means that something is happening. When you're pregnant, you're not supposed to bleed in any way. So if you see that, that means either the baby, the zygote that is forming is already cracking the fallopian tube, and then bleeding is coming out little by little. So you must identify your body as a human being, as a woman. Even your husband can even help you, okay? So that when you start seeing all these things exaggerated, you must go to the hospital so that they do the test to diagnose what your problem is and do the needful. Okay? If you start feeling shoulder pain, tip of the shoulder pain, that means that there is something that is happening to your body. Or if you start having bowel movement every time you go to the toilet, every time you go to the toilet, every time you go to the toilet, or you start having blood streaks, okay? On when you clean up, you start having blood streak. That means all these things that you're having, the shoulder tip pain, the excessive bowel movement every time you go to the toilet, is showing that there is leakage of blood from the fallopian tube. So when this thing happens, it means that the blood that is being collected, the blood that is coming out from the fallopian tube is leaking out, and it's getting to be collected by the nerves. So when the nerves, when the blood touches the nerve, they get irritated. So when they get irritated, that is the way you start seeing all that you are going to be seeing, okay? Yeah, Yudi, just listen. I don't want you to talk. I want you to just to pay attention. Just share it, and so that, because I'm still on the point where I am discussing. Okay, I don't want to begin anybody. See, people are coming from everywhere. This is a very important situation because a lot of women have died because they had ectopic pregnancy. They didn't identify it on time, and by the time they identified it, there's nothing the doctor could do. There's nothing anybody can do. Okay, so one of the things you do is when you see all these signs and symptoms, even if you have a baby and you are seeing that, oh, you're having a shoulder tip pain, you're having excessive bowel movement, or any of these things that I said, please, it is very, very important that you run to your obstetrician immediately and say, hey, obstetrician, look at this, look at this. These are the things that I'm seeing, these are the things that I'm not seeing. And a definitive diagnostic test will be done, which is the ultrasound, so that we'll be able to identify whether it is ectopic pregnancy, and you do the needful. Okay, now there are some emergency symptoms that you can also see. Okay, especially this is when the fallopian tube have ruptured. This baby, they grow every minute. When that fertilization has happened, the zygote is growing every minute. Okay, so if you start seeing bleeding or very severe abdominal pain that you cannot bear, it is showing that there is rupture of the fallopian tube until proven otherwise. Okay, it is very, very life-threatening. Okay, and you must start running to the hospital. That is a very, very bad situation, and it is an emergency thing can happen at that time, because this means that you are bleeding seriously and your fallopian tube have ruptured. All right, now, but before this thing goes to this point where you're going to start feeling lightheadedness, you're going to start feeling fainting, or you are in shock, if you have severe abdominal pain, pelvic pain, vaginal bleeding, extreme lightheadedness, fainting attack, or shoulder tip pain, these are the signs that will make you go to the hospital. Don't wait until you have gone into shock, because when you are in shock, you can't even move. You can't even do anything, because you're already unconscious and there's nothing you can do about it. Okay? Now, what are the causes of ectopic pregnancy? There are so many myriads of reasons why you should have, or why you have ectopic pregnancy. You have to share, because I'm not seeing you share. The people in Instagram are sharing. Guys, I hope you are sharing. You're sharing, because this is very, very important that you share this, so that a lot of people will know, because a lot of women have actually died because they had ectopic pregnancy, they didn't know about it, the people around them didn't know about it, and at the end of the day, they died. But if they had picked all these things, just like hair tutorial and lifestyle presenter picked and saw that no, something is happening in my body that is not right. And besides, I went to the hospital and they still told me that the fetus is not in my womb. Something is happening. Okay? Now, number one, if you have had inflammation or infection, instead of young men and women, they just tell you that we want to do it raw. They don't want to use protective or even stay away from sex. Abstinence, to tell you the truth, abstinence remains the gold standard of not having ectopic pregnancy. But guess what? This ectopic pregnancy happens to people that are married. If you are not planning to give birth or you don't want to have any child during marriage or out of marriage, right? So I can't say abstinence because you married because you are going to have sexual intercourse with your wife. So I can't say, oh, abstinence remains the key. No, what I'm just trying to say is because of infection, if you are a young girl and you can do without having sexual intercourse so that you don't expose yourself to undue infections that you ordinarily shouldn't have, why don't you stay away until you get married? Okay? And then for you out there, these young men that are married or old men that are happy trying to have, external affairs from their women, just know that that lady you're seeing, that man you're seeing outside of your wedlock could be harboring a lot of infections. I have discussed that before, right? If you haven't seen that video about the infections, I discussed it some few weeks. If you are here and you were in that discussion, please comment on the comment section and tell me that you actually followed. UD, were you in that discussion? Because why I'm calling him, he is one of the people that always come up on my show and he answers my questions and everything that is on my channel. So comment and tell me if you have, even if you were not present when I discussed it, tell me about it so that we will know that you have already done something about infection, right? So if you have STDs, okay, such as gonorrhea, chlamydial infection before this pregnancy, all right, it could have been that these infections have caused inflammations on your fallopian tubes or even the nearby organs in your fallopian tube. It's possible that you have that inflammation, and as a result of that, when you are pregnant, the possibility that you're going to have ectopic pregnancy because of those infections, your fallopian tube is now narrowed, okay? Or there's a kind of scar on the fallopian tube, so that could make you to have ectopic pregnancy. If you have had tubal surgery of any sort, either because you have had a prior ectopic pregnancy and they went in and removed it, or they noticed that you had a blockage on your fallopian tube and the doctor decided to do a surgery to open up your fallopian tube so that you'll be able to be pregnant, right? If you had had prior surgeries before to correct a closed fallopian tube or a tightened fallopian tube, okay, that increases your risk of having ectopic pregnancy. If you have been on birth control, you heard me right, because every woman will just run boom 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 boom, please give me birth control, I want birth control. Some people will put copper T, some people will take other forms of contraceptives. Those kind of contraceptives, especially the IUCD, that is intrauterine device, where they go through your vagina and put all those things, particularly copper T. The time they are putting the copper T, possibly that they could have, touched somewhere and it started bleeding and it will heal, but there will be scar formation, okay? It's there. All right. Now, this also raises the risk of having ectopic pregnancy when you are pregnant, okay? Now, smoking is another very, very serious predisposing factor in having ectopic pregnancy. If you are the kind that smoke, before you decide to get pregnant, you must stop that smoking. You must say, you know what, I am not going to smoke again. You must have to stop the smoking weeks and months and even years before you decide to get pregnant, because it has been noted that smoking cigarettes or any form of smoke whatsoever, but particularly cigarettes, before you get pregnant can give you a very high risk of having ectopic pregnancy. I hope you learned something today, and I hope you are there that find succor and happiness in smoking as a lady. Now you have now heard that when you want to be pregnant, you need to stop that smoking a long time before you get pregnant. Because guess what? You could actually have ectopic pregnancy from just smoking. All right. Now, what are the complications of ectopic pregnancy? Because we know that rupture of the fallopian tube. Okay. If you don't do that treatment and discover your body on time, if you rupture your fallopian tube, it is going to be a devastating situation. You may bleed. Bleeding will lead to life-threatening situations that your doctors are going to be running helter-skelter to know or ask themselves, oh, so what are we going to do? So, my dear people, what are you going to take best? Is it to leave yourself and continue managing until you buy, or to identify your body on time and head to the hospital to save yourself? Because guess what? This woman that have ectopic pregnancy may have little baby that she's carrying, may have older children. When you buy, who is going to take care of your children? Whereas if you had time and do the right thing, you can identify that you're pregnant and stop whatever thing that is causing that issue and be alive, if not for anything, for yourself. Okay. Now, what are the preventive things? I'm going to wrap up by telling you that there's actually no way to predict or even to prevent ectopic pregnancy, especially if you already have a scar or if you already is. But the number one place that you can actually prevent pregnancy that will get to ectopic pregnancy is if you're smoking and you stop smoking. If you stop smoking, the possibility that you're not going to fall into the category of people that are going to have ectopic pregnancy is 100%. Okay? Now, the only thing you can actually do is just to reduce the risk of having ectopic pregnancy by, number one, limiting the number of sexual partners that you have. Okay? Do not go about having sexual intercourse with every and anybody that you see, because you don't know what they are harboring. Okay? And make sure that when by peradventure you decide to do this sexual intercourse without thinking about any other thing, just think about condom. Use your condom and make sure that that condom is worn very well so that you prevent yourself from STIs, sexually transmitted infections, and thereby you will reduce. And then when you marry your wife, stay focused with your wife or husband. Don't go doing other side chick and side hen and side cock thing. Okay? Finally, stop smoking, especially if you want to have. The doctor is going to do an abdominal scan, pelvis scan, and these are the ways that they will be able to identify that you are having ectopic pregnancy. So I will stop here. If you have any questions, ask me the question. I am going to bring in some people so that they would tell me if they have anything to let me know. Okay? Please, if you come in, just ask your questions and go straight to the points. Okay? All right? Okay, so All right, so I am going to invite some people if you can, but if you cannot, no problem. So we have come to the end of this discussion, and I hope you actually got a lot from the discussion and you learned a lot. Please, ectopic pregnancy is a medical emergency. Even if it is your enemy that is having ectopic pregnancy, please, it is very, very important you keep aside the anger. Keep aside the anger and help this person to go to the hospital. Guess what? That one person you save and take the person to hospital and the person is alive will thank you and will appreciate you at the end of the day. All right, so thank you all for watching. We have come to my favorite part of the show. Now listen, if you can't send your answer during this live broadcast, don't be offended. Don't be angry with yourself. Don't beat yourself on the back or get angry. All you need to do is still answer on the comment section so that you will be one of the people. Listen, I have 3 platforms. I am zooming live, and you are going to have, you are going to get the giveaway, irrespective of the platform where you are. Okay? So my question today, number 1 question is, what topic did we discuss today? Type on the comment section. Let me know, but you must have shared this live. You must have followed me on the platform that you are going to answer this question. You must click on the following button and comment on the comment section and tell me where you're watching from. You can say Africa. You can say North America. It doesn't matter. I don't need to know your location, okay? So what topic did we discuss today? That's number 1 question. Number 2 question is, tell me the signs and symptoms that a woman will feel or complain about that will make you understand that, oh, this person is really, truly, truly, truly having an emergency, okay? Now, number 3 question is, what are you supposed to do when you start feeling all these signs and symptoms? Do you just sit at home and say, okay, the lightheadedness will go away, the abdominal pain, the tip of the shoulder pain I'm having is going to go away? Is that what you're going to do? So if not, what are you going to do? Comment on the comment section. Send in your answers, and I guarantee you that you will be one of the lucky winners of my giveaway. All right. Thank you all very much for listening. I remain your favorite doctor, Dr. Tonia of True Health with Dr. Tonia. Please like this video, comment, turn on your post notification button so whenever I go live, you will be the very first. Yes, I mean very first. Yes, I mean very first from all social media, TikTok, X, and so many other ones, including but not limited to Snapchat. So thank you all for listening, and I hope you learned something today. Now, my final doctor's orders is, ectopic pregnancy is real. A lot of women have died and didn't make it. So identify your body language, just like the hair tutorial and lifestyle presenter identified her body language. When she started feeling all those little things, she went back to the hospital and they did a scan, and voila, the pregnancy sperm, her husband's sperm and her egg, and they fertilize it. And bingo, they will have a baby that a surrogate will carry. That will not make you to like that your baby any less. Okay, regardless however you believe you carry your baby. Even people that have had their baby by just merely doing adoption is also their baby. So this one that even have your chromosomes, okay, 23 chromosomes from your egg, somebody just carried it for you, okay, it's still your baby. So thank you all for listening. My final thought this morning is health is wealth and knowledge is power. This is your favorite doctor, Dr. Tonia of True Health with Dr. Tonia. Please share me out, okay? Bye bye. See you soon because I have more intriguing, more interesting, and wonderful topic to discuss. Ciao, ciao. See you soon. Bye bye.